Proper width and length is determined by the patient's extremity size and indication. Additional padding is not necessary unless requested by the physician, but be sure to protect or pad the edges of the splint. Use cool, clean water and do not oversaturate. Never use hot water. The material can be put on dry, but it will take longer to set, about 20 minutes. If you wet the product, roll inside a towel to remove excess moisture. When customizing, cut the substrate before wetting. Apply bandage wrap on the extremity with minimal tension, covering the entire splint. Do not overstretch the bandage. Smooth the splint without squeezing, using the palms of your hands, not your fingertips. Once the splint is on the patient, always monitor for patient comfort and neurovascular compromise. Now we will demonstrate the proper application of a series of splints. First, the volar splint. Indications for the volar splint include wrist sprains, strains, carpal tunnel syndrome, lacerations, and night splints. Select the correct width. The length of the material is measured from the distal palmar crease 2 inches distal from the antecubital. Once you have the measurement, pull out the foil from the orthoglass product roll and cut it to the length you need. Be sure to push the remaining material back inside the foil. Smooth away any wrinkles and clamp the foil securely to keep the unused portion fresh. Stretch the edges of the padding over the substrate. Stretch one side, then the other to protect the patient's skin from the exposed edge. The material also can be trimmed for patient comfort. Secure the splint once around the wrist. Wrap distal to proximal, overlapping the bandage by half its width as you spiral down the extremity.
From the center of the splint to the palm of your hand, smooth it out. From the center, palm of the hand.
Next is the thumb spica. Indications include navicular or scaphoid fractures, thumb dislocation, ulnar collateral ligament sprain, and tendinitis.
Just take the same splint and spiral it a little to the dorsal side of the hand. Slightly spiral it and take your bandage and lock it into the wrist first. Bring this tab on the bottom and just lock that in and around so now it's captured. At the very tip of the thumb, fold, overlap, and figure 8 once over the top. Come down low with the second wrap over the top again, 2 figure 8s, and then up towards the top again using 50-50 coverage, half the bandage. Position that thumb down to oppose the index finger, position of function, oppose the index finger, normal extension of the wrist. You can have the patient hold on to another bandage if you like, just to maintain the opposition to the index finger.
Our next application is splinting the 4th and 5th metacarpal, sometimes called boxer or gutter splints. Indications for this splint are fractures or lacerations. Cast padding can be used to protect any bony prominence. Wrap the padding 3 or 4 times loosely around the wrist to protect the ulnar styloid. Also pad between the fingers.
Lock it in once around the wrist, come through the thumb, just capturing the 4th and 5th only. Once, twice, coming around the back of the hand towards the elbow. 50-50 coverage, again pulling on the splint. Relax on the patient, 50-50 coverage. Now position the patient down. We'd like to see them down to at least 45 degrees of flexion is acceptable. 90 degrees is ideal. Always check with the physician for proper positioning. Extend that wrist back to about 20 degrees of extension so that what we're looking at is about a cobra strike position.
Is the finger splint. Indications include finger fractures, lacerations, and tendon repair. Measure around the second and third fingers and choose the appropriate size orthoglass splinting material. The length will be from the tip of the third finger coming down to just above the wrist joint, leaving space for flexion and extension of the wrist. Measure longer if you also need to immobilize the wrist. Before wetting the splint, hold it up to the patient's hand. Come down to the web space of the fingers and mark the material. Sometimes a pinch can be used to make the mark. At the mark, pull up the double-faced tape and remove the coated substrate. Fold the substrate in half and cut from the bottom up to the mark, and then cut out the fold. The material should now look like a pair of trousers. Place it back on the padding and close. Stretch the padding. Cut the padding up the middle so the edges of the substrate are covered.
Always pad between the fingers with some cast padding, and then take your splint, come down, and capture those two fingers. Take the bandage and just lock it in once around the wrist. Come down, up towards the fingers. Once, twice, and that's it for the hand. Come back down and finish at the wrist. Now you position it. Bring that patient down to flexion. Safe position. Again, always check with the physician for proper positioning. I like to add a little tape to this to maintain splint position. Just take some tape. Half inch would be good. And just take it right at the middle. Come across, figure eights, back of the wrist, and if you need some more flexion at the MCPs, just take it in the middle and twist them down, and that will hold it for you.
When using this technique, check the tips of the fingers for capillary refill, both before and after you splint. Application is a thumb and wrist immobilizer. Indications include a scaphoid fracture, wrist injury, or combination of the two. Cut the material to the measurement and stretch the padding. Mark the base of the thumb and cut obliquely at the palmar crease. Trim to protect the patient from the exposed edge.
MCPs are free. Come on down. Take your bandage and just lock it in at the wrist, first to stabilize your splint. Nice smooth contour through the thumb and the hand. Then take this piece here and just come around the thumb Immobilize the thumb, come around, capture that once, around the wrist, come through the web space one more time, end up towards the elbow.
Smooth the splint from center to side. Position the hand for function in the handshake position.